A lot of the people that we kind of work with have what's known as like a dual diagnosis. So they've got a diagnosis of a substance use disorder, and they've also got a diagnosis of a mental health disorder. And what we're finding is that a lot of the people we support, when they're kind of attending other mental health services, maybe due to their kind of like just current lack of stability, maybe due to their kind of current criminal justice involvement, or the fact that they are kind of actively using substances, they're kind of deemed unsuitable and kind of fail to access support there. And I think the issue with kind of dual diagnosis is that it's easy to say that if you kind of stop using substances, your mental health will improve, do that first. But then how do we go about that when you think that the substance use is there because it's quite often the coping mechanism for the mental health? And I think it's just this kind of quite difficult feedback cycle where both are kind of reinforcing the other. So I think what's really important with the work that we do is that we kind of quite often joint work with practitioners. Our mental health support is available alongside substance use support, so that kind of like both sides are being tackled at the same time. Let's say there's a situation where someone that I was working with identified that whenever they kind of like ran into a certain group of friends or attended a certain location, they quite often found that a trigger to kind of their substance use. It could be the case that we could do a joint session with the caseworker, the person we're supporting, and myself, where we kind of develop a plan of, okay, so what's the best way to cope with your mental health in this situation? What would be the best way to cope with kind of substance use in this situation? And kind of really try and tackle it from both sides to kind of prevent maybe relapses or deteriorations in mental health. Something that we could kind of bring to the table and discuss is kind of maybe like, I know a lot of practitioners do this already, but the pro-cons list of kind of engaging in substance use or engaging in certain behaviours. But we can also bring, if you're thinking of kind of like distress tolerance skills, the TIP skills are really great, where kind of like you might use temperature, kind of muscle relaxation, breathing or intense exercise, all those kind of ways to kind of like try and control your distress. And what we try and do in our sessions is that we practice these skills. We might practice kind of like a breathing exercise, muscle relaxation, so that when individuals are faced with these situations, they kind of got a bit of practice behind them. They know kind of maybe what might help them, and that they've just got an option that might be something else rather than turning to substances.